Hello, good morning. Thanks for joining in today. Today I'm going to talk about a condition called splenomegaly, or in other words, a large spleen or splenic enlargement. This is not to be confused with a condition called hypersplenism. If you're looking for hypersplenism, what it means, then I'm going to upload that video next. Hopefully you'll have it over the next few days, so do watch it. So we're going to talk about enlarged spleen today. So I've drawn a torso of a person. So this is the right side, this is the left side, this is the right breast, this is the left breast or the nipple. This black thing here is the belly button or the umbilicus. This is black line is the margin of our rib cage on the right side, and this side is the left side margin of the rib cage. You can feel it on your tummy if you want to. This is the right side of the diaphragm. This is the left side of the diaphragm. Diaphragm, as you know from my previous videos, is a muscular sheet which separates our chest from our abdomen. Underneath the right side, this green thing is the liver, and underneath the left side of the diaphragm, this red thing is the spleen. And as you can see, and as I explained in my previous video on the spleen, that spleen is tucked underneath the left side of the rib cage, under the left side of the diaphragm. Is size of my fist normally, and like my fist has got grooves underneath where my fingers are, precisely the spleen has got grooves underneath as well. When a doctor is examining the patient, they cannot feel a normal size spleen under the rib cage. It's quite well tucked in. The reason is nature protects our spleen because spleen is a very vascular organ, as you know, very rich blood supply, and it's a very delicate organ. So any blow on the tummy or any accident can rupture the spleen if the spleen was not protected by nature. So nature protects our spleen in front by the ribs, at the back by the back of our ribs and our spinal column. When the spleen becomes large for whatever reason, which we will discuss in a minute, it still will not be palpable unless it is 2 or 3 times the size of a normal spleen. So it starts becoming palpable. As you can see, I've drawn these dotted lines here, and the spleen, when it becomes large, it grows not just down but also across the tummy, so goes towards the right side. So twice the size of the spleen will be about here, 3 times will be about here, then it goes bigger and bigger and bigger. And I have seen in my career spleens size of literally size of a football, weighing about 9 to 10 pounds. So they can become quite large. So what can cause the spleen to become large? The list is as long as my arm. So I'm going to try and divide this according to the function that spleen does in our body. So as you know from my previous video, and also from your knowledge, that spleen is an immune organ. It's like a big lymph gland in our body which protects our body against infections. In doing so, it can get infected itself. And when it gets infected, it becomes quite large. So common causes, especially in the West and also most parts of the world, would be infections. The second common causes would be if there is any blockage to the blood flow from the spleen. And I will explain this again in a minute. So I'm just going to briefly touch them and go back on each of them one by one. Third commonest cause would be blood disorders. And again, I'll explain it in a minute. Fourth, very uncommon cause is metabolic disorders. And I will not explain this any further or discuss this any further because these are very, very uncommon conditions. And this basically is when a person is born with a condition in which they cannot utilize either their carbohydrates or their fats or their proteins properly because certain enzymes are missing from their body, especially the liver. And either the fats or the carbohydrates or the proteins or whatever collects in different organs of our body. And one of them is the spleen. These are inherited disorders. They go from one generation to the other, and the person is usually born with these disorders. And they present in early adult life with either a very large liver and also a large spleen. So I will not discuss this any further because they are quite rare. Going to touch each of these one after the other. I'm not going to go into depth and details of each because there are so many conditions which can cause it. I'm just going to touch or discuss briefly the commonest causes that we come across in medical practice. So let's first talk about infections. As you know, we can get infections from either bacteria, viruses, parasites, fungi, etc., etc. And any of these can cause our spleen to enlarge. Infection of the heart with bacterial infection called endocarditis can make the spleen become very large. Very common viruses like infectious mononucleosis or glandular fever can give rise for the spleen to become large. And this perhaps glandular fever is by far the commonest type of infection that can make the spleen to become large. Many parasites can also cause the spleen to become large. Many parasites which infect the liver can also infect the spleen because the two organs share their blood supply. And any of these infections, whether bacteria or viruses or parasites, can make not just the spleen to become large, but also the liver to become very large. Second cause I'm going to talk about is obstruction to the blood flow. This again is, in my view, is perhaps the second commonest cause of spleen becoming large. And as you can see, I've drawn the liver there, spleen there. There is a red tube coming into the spleen. This is a splenic artery which brings blood into the spleen. The blue coming out is the splenic vein which takes the blood out of the spleen and back into our body, and it comes and it joins a big blood vessel called the portal vein, and the portal vein goes into the liver, and from the liver it goes through into the heart. As you can see, if the blood is coming into the spleen but can't get out, so there is back pressure of the blood in the spleen, it will make the spleen become large. It's like putting a dam in front of water, which makes the water build behind the dam. So exactly the same things happen, that the blood is coming in but can't go out. And there could be many reasons for it. And one of the reasons, the splenic vein is blocked. It's got a blood clot in it, or there is a problem with the pancreas because pancreas is around here somewhere. And either there is a tumor in the pancreas, it can block this vein and stops the blood coming out of the spleen. The portal vein might be blocked. The liver might have disease like cirrhosis, which I did discuss in my previous video on portal hypertension. Do watch it. So portal hypertension is a very common cause of spleen becoming very large because of the back pressure of blood into the spleen. In these patients, there is nothing wrong with the spleen. The problem is outside the spleen, which is blocking the blood coming out of the spleen. So the spleen is enlarged not because it's diseased. The spleen is enlarged because it is very, very congested with blood. You might remember from my previous video when I discussed the functions of the spleen, that spleen, when the child is in mother's tummy, when the mother is pregnant with the baby, first few months of pregnancy, the spleen is the main organ which forms blood. And as the baby grows older and when the baby is born, then most of the function is picked up by the bones to make blood, and the spleen stops making blood. Also, the second function I talked about was that the spleen is responsible for removing dead and dying blood cells from our body. And any abnormal blood cells that are produced in our body, spleen tries to get rid of it. So, next cause that we talk about is blood disorders. So any condition which give rise to abnormal blood cells in our body, like leukemia, which is the blood cancer we talk about quite frequently, lymphomas, which is the cancer of the lymph glands and the lymphatic system, myelofibrosis, in which bones stop forming blood and the spleen has to pick up the function of making blood once again in an adult, spherocytosis, thalassemia, early sickle cell disease, common conditions in certain parts of the world in which the blood cells are not normal and the spleen tries and kill these blood cells, and in doing so becomes very, very large. With the cancerous conditions like leukemia or lymphoma, the spleen not just trying to get rid of the abnormal blood cells, as a matter of fact, can develop the disease itself. So might be have a spot of leukemia or lymphoma in it, which can give rise the spleen to become very, very large. So what are the symptoms of spleen becoming large? Very mild splenic enlargement, say spleen is twice the size or 3 times the size it normally is, usually don't give rise to any symptoms. In many patients, what is causing the spleen to become large, like cirrhosis, portal hypertension, uh, glandular fever, leukemia, lymphoma, spherocytosis, anemia, etc., will be the main symptom. And spleen itself will not be causing many symptoms unless it is very, very large. If the spleen becomes very large, the main symptom is pain. And the pain is under the left side of the rib cage. And when you touch the spleen or the abdomen is pressed, then it hurts the spleen. If the spleen enlarges very, very quickly, then it is very, very painful condition. If the spleen enlarges very slowly over months or years, then it's relatively painless. Another site of pain is when the patient lies down or is coughing or taking a deep breath in, is pain in the chest, like pleurisy pain, or also sometime on the tip of the left shoulder. It can hurt when they take a deep breath in, especially the spleen is very large. How do we diagnose splenomegaly? One way of diagnosing it is examining the patient. So if the patient comes to the doctor complaining of pain under the left side of the rib cage, the doctor will examine the patient, and when they examine under the left side of the rib cage, they can feel the notches of the spleen, which means the spleen is enlarged. Not the most reliable way of diagnosing or ruling out splenic enlargement. The reason is because it depends on the experience of the doctor, depends on the build of a patient. If the patient is very large, very muscular, or overweight, then you can't examine the spleen easily. Ultrasound scan is a very easy way or cheap way of diagnosing an enlarged spleen. CT scan is a very reliable way of not just diagnosing an enlarged spleen, but also measuring the size of the spleen and also trying to find the cause of splenic enlargement, because CT scan can also show whether there is blockage of the splenic vein, or there is a tumor of the pancreas, or any other problem with the pancreas, or there is cirrhosis of the liver, or there is portal hypertension, or there is other problem that might be going on which might be making the spleen to become large. MRI similarly, because it's a body scan, can diagnose splenic enlargement much better as compared to ultrasound scan or clinical examination. I hope you found this video informative, and if you did, then please do remember to like and subscribe, and until next time, I'll see you soon.